health issue they're dealing with.
Yeah. All right, let's dive into it. The mental imagery thing, because before the podcast started, I was asking you just a little bit about it, but you talk about how you use mental imagery in your practice to help people with healing. You use imagination to help people with healing. Because I mean, most people, including me, when you first hear that, you're like, "What the hell does that mean? Is that like, what's this like maybe woo woo type topic, and does it actually work, or what does it actually mean?" So, give us a little background of who you study with, or like what got you motivated to learn about this healing practice, and we'll go there. We'll go from there.
Okay. Yeah, well, I ended up, well, first of all, the concept of visualization has a lot of scientific uh, you know, work done
Yeah.
on it. There's sort of a concept of mirror neurons that, your body experiences things, almost identically to how you imagine them. That's why in athletics, visualization can be very, very potent. Many people are aware of, the free throw. There's a free throw study where, people just sort of visualize themselves shooting free throws, and some actually did free throws, and then some didn't do anything. And the people that visualized, I think they improved just as much as the people who actually practiced free throws. So its basis is sort of similar to that in this from a scientific perspective.
Right.
The technique itself was taught to my teacher. His name was Gerald Epstein. He was a psychiatrist who was actually a Freudian psychologist, and then met his teacher, who was sort of a I guess you would call her a Kabbalist, a mystic who lived in Jerusalem. She had secular people, religious people coming to her, and she taught a very specific technique that was partly passed down through her family, which basically involves um, a quick 15 to 30 second, usually it's less than a minute, short imagery process where people use their imagination. So I can give you an example of a patient, probably is the easiest thing. I had a patient who had what's called neurodermatitis, which is a condition where she had an underlying eczema, but she was picking her skin off, like, just subconsciously.
Wow.
So in this particular example, I gave her the breathing. There's just sort of three out breaths. She closes her eyes. I lead her through a thing, and then of relaxation, and then I ask her to tell me what her disease looks like, to give it an image. Like, for example, if I asked you, what's the picture of calm to you? What pops into your mind if I ask you?
Uh, First thing that popped in my mind is looking up in the sky and clouds for some reason.
Okay, exactly. So, people come up with different things. If I asked you, what does anger look like to you?
Ooh,
What
f-
pops into your mind?
fire is the first thing that came into mind for some reason.
Fire, exactly. So everyone comes up with their own thing. Well, in this particular patient, I asked her what her condition looks like, and she said it looks like barbed wire, um, pulling across my skin. So I asked her to reverse that. What's the opposite of the image of the barbed wire? And she said immediately, smooth glass tubes. So basically, I just had her visualize 3 times a day the smooth glass tubes, um, and that was enough, really. After 3, 4 weeks of doing that, she was really able to stop the uh, subconscious picking. Now, the value here is that what makes this very different from your standard visualization is that she was the one that came up with the images.
Mm.
And so when you're using your imagination and you're learning the the symbols that you come up with in your own mind, this provides a link to a much deeper part of yourself than people realize, and it's readily available. And the fact that it's so close to us that we can access this sort of internal, personal imagery means that it's just really, really a powerful process. And so this can be done. There's lots of different techniques within the imagery that are similar to what I just described. where you can not just from a healing perspective, but from just a personal growth perspective, you can really get access to, as I said, sort of a deeper part of yourself through learning your internal language of image. Because most of us, the majority of people, we may not even be conscious of it, but we are almost the majority of the of people in general are thinking in images. They may not be consciously aware of that fact, but when you become consciously aware of that fact, and then again learn to understand the images that your mind is coming up with, there are a lot of surprising things that happen. And in this case, just going back to this particular case, is sometimes the images are unexpected. As an example, you sometimes, it's your imagination, of course, but sometimes your imagination populates things that are just sort of funny or surprising or whatever the case. I remember once I was seeing my teacher, and was dealing with some health issues myself, and I quickly went into an image, and then I just saw something that was very, very funny. And to me, it was sort of like a waking dream in the sense that I understood what that humorous image was and why it was there, because I was feeling a little bit depressed. And so my imagination came up with these dancing, like little garden gnomes. This is what popped into my head. Anyway, it was what I got out of that, of course, was a deeper part of myself, which we all are aware of, that we have a deeper part of ourselves, was populating in my imagination that I needed to lighten up. That I needed to be a bit less serious, and this is sort of how it manifested. So you can look at it almost like a waking dream, in
Yeah.
that sense, that because these things spontaneously come up while you're exercising your imagination.
Yeah. Okay. My head is going a lot of different places right now. I think, and I want to get to in a second, like different applications for this in different ways that maybe you've used it with other people, in different ways that maybe you've used it yourself. But I want to go back to this one patient of yours who had neurodermatitis, and she was picking at her face a lot, and you had her visualizing the smooth glass tubes that she came up with in her mind. You said 3 times a day. Is there like a protocol that you guys have, like 3 times a day? You want to be doing it for 5 minutes, 10 minutes, 60 seconds? Like, is there a particular protocol that you guys have for that?
Yeah, yeah. Well, first of all, the process is you sit with your feet flat on the ground, your arms at your side, and you do three slow out breaths with a normal in breath. And that's just the slow out breath activates the parasympathetic nervous system, so you relax. And then you internally say just to yourself or externally, I'm doing this imagery process to do X, Y, and Z, whatever it is. And then you do the image. It can be very, very quick. And then you breathe out one time, you open your eyes, and you're done. You do